And Dr. Salim Surani joins us live to help ease some of your concerns that you may have. Dr. Surani, thank you once again for being with us this morning. We appreciate you as always. Now, earlier, there were some parents that were concerned about their children having heart issues if they were to have the COVID vaccine. What is your take on that?
Good morning, Barbie. Glad to be here. I think anytime any parents, if they have a concern, issues, hesitancy, those are all normal. That means that they have some questions which need to be answered. And one of the things is what we have seen when the vaccines were rolled out, especially with the messenger RNA-based vaccine, especially in adults who are 30 years and younger, they had some incidents of myocarditis. And those incidences are very, very low. If you look at it, almost a billion doses of the messenger RNA vaccine has been given, and we had some handful cases of myocarditis. But when they look into the data for the children, they specifically look at that. And one of the things to the ease of the parents and the scientists and researchers and regulator was that they did not find any evidence of myocarditis in this younger age group. And especially that is a very good news for the parents. One of the questions which I was hearing from the viewer, and they say that, my kid is healthy, why we need to get the vaccine to the kid who is healthy and has a good immune system. Yes, they are right that especially when the COVID-19 came in, it affected the folks who are immunocompromised, elderly, some chronic health condition, and not so in the healthy group. But when we look at the data among the children, almost 50% plus, or majority of the kids who were healthy, they also got infected. And a lot of them, they end up in getting hospitalization and some death has ensued. So I think having a healthy kids is a blessing. But again, the protection is the key, and we have the medicine which can help, or the vaccine which can help them to protect from that illnesses.
How long are they protected, the kids at this age group, after being fully vaccinated?
The main thing is that obviously it can last longer, but the data we have is about 6 months minimum.
For those parents that say, my child has all of their booster shots, they don't need a COVID vaccine, what do you say to them?
The main thing is that, we can also say that some of the parents have the thing that my kid already had a COVID-19. And we know that, the number of the kids who have a COVID-19 mild infection can range as high as even 40% with some of the data and prediction models. The main thing is that we have seen as in the adult that when you have an infection with the COVID, the immunity does not last as long, and the antibody production is not as high as when they receive by the COVID-19 vaccine. So the vaccine in the kid, you have to see that it's been tested. It's 1/3 of the dose of the adult. And we give the kids vaccine for the disease, which are much less lethal and much more, safer than the COVID-19, which has caused almost 2 million cases in the children, more than 8,000 hospitalization, and even more than 100 deaths. And again, we have the multisystem inflammation syndrome by the COVID too. So I think when you look at the risk benefit, I think it would be a much more easier decision. But I still understand the apprehension for parents. I think even when the baby tried to take the first step, I think we are hovering around the kids and make sure that they can walk safely. So I think concern is right, but again, when we look at the information, it's a very safe for the children, and we have to do where the benefits are more and risk are less.
Dr. Surani, as always, thank you so much for being with us this morning and answering our questions. If you have a question for Dr. Surani, you can still send a text to the number on your screen, 361-855-6397.